The mode of growth for benign, expansion. For malignant, it grows at the periphery and it has infiltration. The rate for benign, slow. For malignant, it is fast. Metastasis for benign, absent or has no metastasis. For malignant, yes, there is always metastasis or spread of cancer cells. General effects for benign, localized. For malignant, it is systemic and generalized. How about tissue destruction and causing death? For benign, it has no tissue destruction, usually that does not cause death. How about in malignant? Yes, extensive tissue damage, and of course, it usually causes death. Alright, so that is the comparison between benign and malignant. Now, how does cancer cells are proliferating? Paano? Let's start with your oncogenesis. Okay, when we talk about oncogenesis, it talks about your cancer development, cancer progression. Okay, now, we have 4 stages of cancer development. Number 1, stage of initiation. Number 2, stage of promotion. Number 3, stage of progression. And number 4, stage of metastasis. Let's start with your initiation. Dito muna tayo. Pag sinabi po natin class na initiation yan, we are talking about your initiators. Ano yung mga initiators natin? Initiators such as your carcinogens. Okay, now, what are the different carcinogens? Okay, first, una muna, we have what we call your family history. So, kasama sa initiation natin because in our genes, meron tayong tinatawag na oncogenes. Okay? It runs in the blood. Oncogenes. Nagkakaroon lamang ito ng activation in the continuous exposure to different carcinogens. What are those carcinogens? Family history. Pangalawa, kasama din po dyan yung ating microorganisms. What are the microorganisms? That is usually, it could be bacteria or virus. Example, Helicobacter pylori. H. pylori. Anong klaseng cancer? H. pylori is a predisposing factor in the development of gastric or stomach cancer. Okay, what else? You also have your HPV. HPV such as your human papilloma virus. That is your genital warts. That is a risk factor in the development of cervical cancer. So, viruses and bacteria plays a role. What else? HIV. HIV causes Kaposi sarcoma. What else? Hepatitis B. Hepatitis B is a risk factor in the development of liver cancer, di ba? And of course, ano pa, aside from that, kasama din dyan yung Epstein-Barr virus. And that Epstein-Barr virus is a risk factor in the development of lymphoma. Alright? So, there are what we call your initiators. So, una, microorganism. Next, aside from microorganism, kasama din po ang diet. Okay, now, what are the diet that may lead into what? Into the initiation of cancer. Diet po, those diet that is high in fat. Okay, so basta lahat ng mga matatabang pagkain. What else? Lahat ng pagkain which are processed or salt-cured. Ano yung tinatawag nating salt-cured? Ito yung pinroseso. Example are the canned goods, di ba? What else? Aside from that, aside from your salt-cured, processed foods, which contains your nitrate. Ano yung mga foods that may contains nitrate? Ito yung mga frozen na processed food. Okay? Sausage, diba? Tocino, hot dogs, they are possible carcinogens because they have the preservative in which we call it as your nitrate or your nitrite. Okay? What else? Aside from your processed and salt-cured, kasama din sa mga pagkain, yung tinatawag po nating smoke cured. Okay, smoke, pinausukan. Ano? Kahit hindi ka nagsisigarette smoking, basta mga pagkain na pinausukan yan. Okay? So, yung mga broiled foods because it may contain your benzopyrene. And that benzopyrene is your, tinatawag po nating mga carcinogens. What else? Aside from that, foods with molds. Okay? So, yung mataas ang level ng molds, ito yung tinatawag po nating aflatoxin. No? So, pag mataas ang level ni aflatoxin, okay, especially kapag yung pagkain natin is medyo inaamag, okay, yun yung tinatawag po natin na aflatoxin, which could be a carcinogen as well, alright? So, diet, okay, could be a predisposing factor, okay, in the development of cancer. What else? Aside from diet, chemicals, alright? What are those chemicals? Pinaka-importante, pinaka-mahalaga, the most common cause or yung most common carcinogen na nagko-cause ng different types of cancer, that is from your cigarette smoking, and that is your nicotine. Ano po? So kasama dyan yung nicotine, kasama dyan sa chemicals that may what? That may cause your cancer. Okay, all types of cancer. Okay, what else aside from that? Kasama din po yung ating alcohol. Okay, alcohol is a predisposing factor in the development of liver cancer. Okay, what else? Other chemicals. Chemicals that could be found during construction of homes and buildings. That is your asbestos, di ba? So kasama din ang asbestos. Okay, that could result into cancer. What else? Aside from asbestos, pesticides, insecticides are highly linked in the development of leukemia, di ba? And any other forms of chemicals such as your formaldehyde, ano? Yung ginagamit natin during embalming process. Okay? So those are the chemicals that could be an initiator or tinatawag nating carcinogens in the development of cancer. So those yung mga chemicals na sinabi natin. Alright, what else? Aside from chemicals, it may also include physical factors. Okay, what are the physical factors? Primarily dyan yung sunlight exposure, di ba? So yung ating sunlight exposure beyond 10, di ba? In the morning and before 3 o'clock in the afternoon, which could be harmful. Ito yung tinatawag nating UV rays. What else? Another physical factor would be your radiation. Radiation that could be found on X-ray, di ba? That could also be a type of carcinogenic. The radiation that is used for therapy, ano? Ginagamit natin as a therapy for cancer, that could also lead into what? An exposure of a healthy person to that radiation may also be a carcinogen or could be causing cancer. So, kasama po ang sunlight and radiation. Alright, what else? Aside from radiation, kasama din po dyan yung tinatawag po natin na chronic inflammation. Okay, say for example, chronic gastritis can lead to peptic ulcer at the same time, nagli-lead yan sa gastric cancer. So, chronic ulceration is another risk factor. So, they are what we call physical factors that may lead into the development of cancer. And of course, hindi rin mawawala yung tinatawag nating hormonal component, no? So, pwede din pala estrogen, di ba? Too much estrogen, too much of androgen may be linked to the development of cancer. Say, for example, high estrogen level could be linked to breast cancer, di ba? High androgen level can be linked to our prostate cancer. Right? So those are the initiator. That's the stage 1. Kailangan that the person should be what? Exposed to your carcinogen. That is what we call the stage of initiation. Alright, next. Let's proceed with the second stage. Na-discuss na natin ang mga carcinogen. The second stage of cancer development, okay, balikan na po natin yung ating second stage. That would be your promotion. Ano po? So, pag sinabi nating promotion, what do you mean by promotion? Promotion is what we call repeated exposure to carcinogen. Okay? So, una, sa initiation, nag-mutate pa lang yung genes caused by carcinogen. Pagdating sa promotion, palagi, daily ka na nagkakaroon ng exposure sa carcinogen. And that exposure or frequent exposure to carcinogen can lead into progression. So, alright, so the promotion stage can lead into progression. Kapag sobra tayong na-expose on the carcinogen, nag-mutate siya, and on the progression, doon nagkakaroon tayo ng starting of your tumor growth. Okay, so may tumor growth ka in which during the progression stage, nandyan yung tinatawag nating tumor or yung tinatawag nating cancer invasion. Ano yung tinatawag nating invasion or infiltration? Nagkakaroon na tayo ng penetration sa different organs in the body. So during that progression, nagkakaroon na tayo ng malignant behavior. Ano yung malignant behavior na yon? Again, the malignant behavior during the progression stage is the infiltration of organ until that specific organ may fail to do its function. Alright. Now, the last stage is your stage of metastasis. Okay, anong nangyayari sa metastasis? Until such time, in-invade natin ang organ. After invasion of that specific organ, what will occur? Since that is a cancer cell, it will continue to proliferate until such time that it will be what? It will have their metastasis or extension to nearby and distant organs in the body. Okay, pag sinabi na po nating meron ng metastasis, ito na yung tinatawag nating stage 4 cancer, terminal cancer. Kumalat na sa different parts of the body. Paano ba kumakalat? Meron tayong iba't ibang method kung paano na tayo nagkakaroon ng metastasis. What are those? Okay, what are those modes of metastasis? First, you have what we call through the blood. Okay, so kumakalat yan through the blood. Second, it could appear through the lymph. Okay, so pupunta yan sa lymph nodes, kakalat through the lymphatic system. And last one, through angiogenesis. What do you mean by angiogenesis? Pag sinabi nating angiogenesis, angio means blood vessel, genesis, formation, or new formation of the blood vessel. So during angiogenesis, nagpo-form siya ng sarili niyang blood supply. So sa halip, instead that the nutrients, oxygen, and other important components should be delivered into the different tissues in the body saan ang napupunta ang mga nourishment. The nourishment is diverted into our malignant neoplasm. So dun sa cancer cell pumupunta. That is why a patient is suffering from anemia and weight loss. Right? So they are what we call the 4 stages. So again, what are the 4 stages? Initiation, promotion, progression, and metastasis. Initiation, it is exposure to carcinogens. Promotion, frequent exposure that leads to tumor growth. Progression, that is your malignant behavior such as invasion and infiltration. And last is metastasis, that involves your extension of cancer cells to nearby and distant organs. Alright, now, let us take into consideration, we have discussed about the carcinogens. Now, let us try to consider how are we going to reduce cancer risk. Alright, so you have your health promotion. Pag sinabi nating health promotion, it is a primary level of prevention. So what are those? First, high-fiber diet, most especially for a patient who are at risk for colon cancer. So pag colon cancer yan, to reduce the risk for colon cancer, the foods that should be taken should be high in fiber. Saan mo makikita yung high-fiber diet? They are your fruits and vegetables. Diba? So kailangan increase intake of fruits and vegetable. You decrease intake of fatty, processed food, meat products because they are considered as carcinogen. So high-fiber diet because these fruits and vegetables contains antioxidants. Ano yung antioxidants na matatagpuan lamang natin sa fruits and vegetables? That is your vitamin A, C, and E. From the word antioxidants, it prevents oxidation of cell, it prevents destruction of cell. Thus, mutation of that specific cells would not occur. So again, what are those vitamins? Vitamins A, C, and E. Okay, second, regular exercise. Why? Because during exercise, the natural killer cells are boosted. Okay, what are the role of natural killer cells? The natural killer cells is having a direct cytotoxic attack to non-self o yung tinatawag nating foreign bodies and also a direct cytotoxic attack towards your malignancies. Ibig sabihin, anong ginagawa ng natural killer cells? It engulfed, it causes phagocytosis of what? Of your malignant cells. So therefore, when we have exercise, regular aerobic exercise can boost the natural killer cells, thus reducing the cancer risk. Alright, next one, third, weight control, losing the weight. Okay? Now, tandaan, obesity is highly linked to different types of cancer. Example, obesity is linked in ovarian cancer. Obesity is also linked in your breast cancer. Alright? So that is why you advise the patient to lose weight. So diet and exercise is the key to lose weight. Another one, foods that are carcinogen should be avoided. We have discussed what are the foods. Di ba sabi ko, salt-cured or processed food, yung mga frozen products should be avoided. Fatty foods should be avoided. Smoked food and those food with high level of aflatoxin. Diba? Naalala yon? So it should all be avoided. Another one, ano nga ang pinaka-cause nga ng cancer? Sa lahat ng klase ng cancer, it is caused by cigarette smoking. So therefore, we need to tell the client to have smoking cessation program. Okay? So you teach the client on how to reduce the smoking consumption of the patient progressively. Alright? And of course, alcohol avoidance. Why? Because alcohol is highly linked with what type of cancer? Liver cancer. Alright. Avoid exposure to different chemicals that we have discussed. Okay. Radiation and infection. Since microorganism could also cause what? Could cause cancer. And of course, stress management. Diba? Sabi natin, lack of sleep. Okay, insomnia, lack of sleep. It causes what? Yung ating natural killer cells ay bumababa. So, pag mababa ang natural killer cells, nawawala yung ability niya on engulfing cancer cells. So, that is why relaxation and different types of stress management should be taught to the patient to reduce the cancer risk. Alright. So, they are what we call your primary prevention. Now, let's talk about now the secondary level of prevention. Okay. When we talk about secondary level of prevention, it is your early detection and prompt treatment. So, dun muna tayo sa early detection. Now, we have your warning signs for cancer. Okay. Before, it is known as your caution. Diba? So, ang tawag dati dyan, caution. Ito yung mnemonics natin for warning sign. Today, we will be using now yung bago, caution us. Now, anong ibig sabihin ng caution us? Letter C stands for change in the bowel or bladder habits. Alright. Anong ibig sabihin yan? Changes in the bladder habits such as presence of frequency, retention, dysuria, what else? Hematuria. Okay, so that could be a sign of a bladder cancer. Changes in the bowel functioning such as chronic constipation. Pag chronic constipation yan, that is a sign of what? It's a warning sign of the development of colorectal cancer. So, tandaan. So, una, letter C, change in the bowel and bladder habit. Alright. Next, letter A. Letter A stands for a sore that does not heal. Sugat na hindi gumagaling. Say, for example, oral ulcer. Long-standing or a chronic oral ulcer can lead into mouth cancer or oral cancer. What else? Aside from that, yung mga lesions that could be found onto the skin, diba? It could lead into the development of skin cancer. So again, a sore that does not heal or sugat na hindi gumagaling. Alright, next one. Letter U. Letter U stands for unusual bleeding or discharges. Okay, say for example, unusual bleeding or discharges that could be found onto the nipples of the breast. No, it could be a warning sign for breast cancer. Dapat walang blood, walang any discharges. What else? Frequent hematuria. That could be what? An indication of, or a warning sign of the development of bladder cancer. What else? Aside from that, you have also your fecal occult. Okay? Ibig sabihin, meron tayong tinatawag na blood streak. Okay? That could be found onto the patient's feces. That could be an indication of colorectal cancer. Hemoptysis. Hemoptysis could be an indicator as well of the development of bronchogenic or your tinatawag po nating lung cancer. So again, letter U stands for unusual bleeding or discharge. Alright, next one. Letter T. Thickening lumps on the breast or elsewhere. Thickening lumps on the breast or elsewhere. Ibig sabihin, may bukol. Okay? So, ibig sabihin, presence ng bukol sa iba't ibang part ng body, specifically, commonly, sa breast. Pag bukol sa breast, it could be a warning sign of a breast cancer. Bukol sa neck area, pag sa neck area, it could be lymphoma or your cancer of the lymph node or leukemia. What else? Okay? Other lumps that could be found on the neck area could be an indication of laryngeal cancer. So you have to take note of your letter T as in thickening lumps in the breast or elsewhere. Okay, next one. Letter I. Letter I stands for indigestion or difficulty in swallowing. Okay, pag sinabi po nating indigestion, hindi natutunawan. And indigestion is a warning sign of gastric cancer. What else? Difficulty of swallowing. Ano naman yan? Pag may difficulty of swallowing, it could be an indication of laryngeal cancer. What else? Esophageal cancer. Okay? So again, when we talk about letter I, that is indigestion or difficulty in swallowing. Okay, letter O. Letter O stands for obvious change in the warts or moles. Obvious change in the warts or moles. Nagkaroon tayo ng mutation of warts and moles. Mutation of warts, genital warts, can lead into the development of cervical cancer. Mutation of a mole, changes in the mole color, shape, di ba? Consistency of it can lead into what? Warning sign for the development of melanoma. Melanoma is your skin cancer. So again, letter O, obvious change in the warts or mole. Alright, next one, letter N. Letter N stands for nagging cough or hoarseness of the voice. Okay, so pag may nagging cough, it could be an indication of what? It could be an indication of laryngeal cancer. It could be indication of bronchogenic or lung cancer. What else? Sabi po dyan, nakalagay, hoarseness of the voice. Diba? Nagging cough and hoarseness. Hoarseness, ibig sabihin palaging malat, palaging napapaos, nawawalan siya ng boses. It could also be an indicator of your or warning sign for laryngeal cancer. Alright. And of course, dinagdag natin ngayon, in this era, you have your caution us, U and S. Letter U, unexplained anemia. Okay, it could be a sign of what? A sign of leukemia and other forms of cancer. You have also your sudden weight loss, in which, sabi po natin, yung nutrients for the body is being diverted into the cancer cells. So they are what we call the warning signs of cancer na kasama po natin that we have to teach the client in the secondary level of prevention. So let us review ano ang kasama natin sa secondary level of prevention. What are the warning signs? You have your mnemonics, caution us. Letter C stands for change in the bowel or bladder habit. Letter A, a sore that does not heal. Letter U, unusual bleeding or discharges. Letter T, thickening lumps in the breast or elsewhere. Letter I, indigestion or difficulty of swallowing. Letter O, obvious change in the warts or mole. Letter N, nagging cough or hoarseness of the voice. Letter U, unexplained anemia. And letter S, sudden weight loss. Alright, now, let's talk about now your early detection, screening. Okay, now, we have different or several cancer screening tests dependent upon the area of your cancer. Tandaan po natin, ano? So, yung itong cancer screening test natin, common din po ito in the secondary level of prevention. Now, you have for the breast for females, diba? For females, most common site sa female would be the breast. So therefore, at the age of 20 to 39 years of age, kailangang mag-perform sila ng breast self-examination every month. Tandaan. And tandaan, breast self-examination is usually performed before or after menstruation. Kailangan tandaan, it is performed 7 days after menstruation, wherein wala na ang effect ng ating hormones. Alright? Because normally, kapag before menstruation, nagkakaroon ng tingling and thickening lumps in the breast. So therefore, it should be performed 7 days after menstruation. Tandaan, it should be performed every month. And of course, you have your clinical breast exam every 3 years. Pag sinabi natin clinical breast exam, it is an assessment done by a clinician or by the physician. So, tandaan, 20 to 39 years old, breast self-examination every month, clinical breast examination every 3 years. Okay, how about for those at risk? Tandaan, the more na increased ang age ng patient, okay, the older the patient is, the more na at risk siya in the development of cancer. So, that is why we will be adding some of your screening tests for a patient above 40 years of age. Tandaan, if that would be more than 40 years of age, okay, it should be done, breast self-examination is every month. Clinical breast exam should be frequent. So, it will be now every year. And the mammogram should also be done every year. Okay, tandaan, baseline or simula ng mammogram starting at the age of 40. Okay, maliwanag po tayo dyan. Alright, next one. How about your cancer screening for cervix? Okay, we start the cancer screening for cervix at the age of 21. Okay, kasi dito tayo nagkakaroon ng tinatawag po natin na sexual encounter. Okay? So, you have your 21. Tandaan, kapag cervical cancer yan, the most common risk factor is your genital warts or your human papilloma virus that could be contracted through sexual intercourse. So, therefore, it should be started for 21 years of age. So, for more than 21 years of age, they need to undergo pap smear every year. How about if the question asks you if, okay, sexual intercourse starts at an early age. Say for example, 15 years old, 16, 18 years old nag-start. Tandaan, if that is less than 21 years old, ang pasyente who are sexually active, okay? Kapag sexually active ang ating minor, okay? You need to have your Papa Nicolau smear within 3 years from the first sexual intercourse. Anong ibig sabihin? Say for example, nag-start siya makipag-sexual intercourse at the age of 14 years of age. So, from 14 until age of 17, kailangan nakapag-start na po tayo ng tinatawag po natin na Papa Nicolau smear. Okay? For detection. So, tandaan, okay? For pap smear, 21 years of age and above every year. For less than 21 years of age, it should be what? It should be within 3 years from the first coitus. Alright, so that is for cervical screening test. Alright, next one. How about for colon cancer screening test? For colon cancer screening test, we start at the age of 50. Tandaan yung keyword 50 na tayo dyan. Alright, pag sinabi natin 50, una, you have your fecal occult every year. What do you mean by fecal occult? Sometimes, this is also known as your guayak. Okay, guayak. Ito yung spelling po ng ating guayak. Ano? Pag sinabi po nating guayak test, okay, it is your fecal occult blood test that should be done every year because possibly, meron tayong blood na present into the stool that could not be visible by the naked eye. Okay? So, hindi nakikita ng ating mga mata. So, that is why it should be examined under the microscope. Naalala ba? Di ba sabi natin, unusual bleeding or discharge is a sign of cancer. So, therefore, we need to undergo, if the patient is more than 50 years of age, the fecal occult or guayak test is every year. Next one, sigmoidoscopy should be done every 5 years. Tandaan yan, yan ang tinatanong sa boards. And colonoscopy every 10 years. So tandaan, for colon cancer, ilang taon? 50 years and above. Guayak or fecal occult every year. Sigmoidoscopy every 5 years. And colonoscopy every 10 years. Alright, next one. Last but not the least, you have your prostate cancer screening test. Okay, tandaan, sinong at risk? Ang at risk again, the more na older ang pasyente, the more na mas at risk po ang ating patient. So that is why for prostate cancer screening test po natin, it would be your starting at the age of 50. Tandaan na naman ang ating age bracket, we start at the age of 50. Okay, now, what are your cancer screening tests for prostate cancer? First in line, yun yung tinatawag nating DRE. It stands for Digital Rectal Exam every year. Okay, ito yung tinatawag na Digital Rectal Exam. Okay, so using a gloved hand, okay, it will be inserted into the patient's rectal area and the prostate will be palpated. Tandaan, normally, the prostate is non-palpable. Okay? Normally, it is non-palpable. If it's palpable, it may indicate enlargement of the prostate o kaya naman, it may indicate your proliferation of prostate cells in which it could be malignant in nature. Alright, so again, DRE should be done every year. And of course, you have your PSA. What do you mean by PSA? PSA is a prostate-specific antigen. Okay, pag sinabing prostate-specific antigen, it is yung tinatawag po natin na mga enzymes that could be what? That could be increasing in a patient with cancer. Okay, so for prostate, that is your PSA. It should be what? Collected. The blood should be collected and to be tested for what? To be tested for presence of elevation of PSA. So kapag at risk sa cancer, tumataas ang level ng PSA. So therefore, it should also be done every year. So again, for prostate, DRE every year starting at the age of 50, PSA every year starting at the age of 50 as well. Alright, so they are what we call your cancer screening test. Natandaan ba ang cancer screening test? I-recap natin. For breast, naalala? Okay, for a patient's 20 to 39 years of age, breast self-exam every month, clinical breast exam every 3 years. For more than 40, breast self-exam every month, clinical breast exam every year, and mammogram every year. Paano naman kapag cervix, starting at the age of what? 21, di ba? Pap smear every year. Pero kapag yan ay earlier than 21, within 3 years from the first coitus. Next, colon. Anong age? Pag colon, starting at the age of 50, di ba? Pag starting of the age of 50, guayak or fecal occult every year, sigmoidoscopy every 5 years, colonoscopy every 10 years. And last but not the least, prostate cancer screening starting at the age of 50, you have your DRE every year and PSA every year. Alright, so they are your screening tests. Alright, let's continue our discussion with the diagnostic test. Now, in the diagnostic test, aside from your imaging technique, di ba may iba't iba tayong klaseng imaging technique. You could use your radiography, CT scan, and MRI in the detection of presence of tumor and masses. In addition to that, we have the confirmatory diagnostic test. Okay, so pag sinabi natin confirmatory diagnostic test, please do remember that the definitive and confirmatory diagnostic test for a patient with cancer is your biopsy. Now, when we talk about biopsy, biopsy entails 3 modes of procedure. What are the 3 modes of procedure? It could be number 1, excisional, number 2, incisional, and last is your needle method. Okay, when we talk about excisional, in excisional biopsy, it entails the total removal of a tumor. Okay, so it entails the total removal of the tumor and it will be what? It will be examined under the microscope by a pathologist. Okay, so that is excisional. Again, excisional, total removal of the tumor. Okay, how about your incisional? Incisional method is used when the tumor is too large to be removed. Kukuha lamang tayo ng portion from it. Pag masyadong malaki and it is too large to be removed, incisional biopsy should be done. And last but not the least, it could be your needle method. Example is your fine needle aspiration, such as in your bone marrow aspiration, in the detection of liver cancer, in the detection of your kidney diseases. Ito yung tinatawag nating needle method. Kailan lamang natin ginagamit ang needle method? It is used when there is a suspected masses. So once again, pag sinabi nating excisional, that is the surgical or total removal of the tumor. Incisional, when the tumor is too large to be removed. Needle method, when it is only a suspected masses. Alright. Now, after that biopsy, it will be checked by a pathologist, it will be examined, and we will have your T and M classification to determine the stage of cancer. Dapat tandaan ito. Ito ay usual also question that is appearing in the boards. What is T, what is N, and what is M? Okay, pag sinabi nating T, letter T, it stands for presence of primary tumor. Okay? So, tinatanong natin, meron ba tayong tumor? Second, letter N. N stands for the presence or absence of regional lymph node involvement. Tinitingnan natin kung kasama na ang lymph node. And letter M stands for metastasis. Titingnan mo kung kumalat na or hindi. Tandaan, pag may metastasis na tayo, usually it is on the terminal stage of cancer, which is your stage 4. Now, how are we going to have your T and M classification? Let's take a look on your tumor staging. Okay, tumor staging T and M. T for primary tumor. Pag nakita mo TX, no primary tumor. Liwanag? TX, no primary tumor. Paano pag nakalagay T0? Okay? No evidence of primary tumor. Okay? So, tandaan TX, it is cannot be assessed. Tumor cannot be assessed. T0, absence of primary tumor. How about TIS? Pag nakalagay TIS, carcinoma in situ. Usually, pag carcinoma in situ, usually ito po ay mga benign classification. And last but not the least, if it's T1, T2, T3, and T4, there is an increasing size of the tumor. So once again, T stands for primary tumor, TX, tumor cannot be assessed. Okay. T0, no evidence of primary tumor. TIS, carcinoma in situ. T1 to T4, increasing of the size of tumor. Alright, now, let's talk about now your lymph node involvement. Pag nakalagay sa lymph nodes mo, NX, lymph node cannot be assessed. Okay, so regional lymph node cannot be assessed. Paano pag nakalagay N0? No regional lymph node involvement. How about N1 to N3? Ibig sabihin, there is involvement of regional lymph node. So once again, NX lymph node or regional lymph node cannot be assessed. N0, no regional lymph node involvement. N1, N2 to N3, there is presence of regional lymph node involvement. Alright, last but not the least, you have your metastasis. Alright, pag sinabi nating metastasis, again, that is the spread or the extension of your tumor. Now, pag sinabing metastasis, MX, metastasis cannot be assessed. M0, no evidence of metastasis. M1, distant metastasis. Ano nga stage pag meron ka ng nakitang M1? That is stage 4. Ibig sabihin, that is terminal cancer. Alright? So, they are what we call your T and M staging. So, thus, if we are going to relate your T and M staging, okay, next slide please. Pag sinabi nating TIS, stage 0. Diba? Ibig sabihin yan, benign lang yan. Okay? So, that is stage 0. Or, pag nakita mong T0, wala tayong makita, no evidence of any tumor. Paano pag stage 1? Makikita mo, pag stage 1, T1, N0, M0. Okay? So, for stage 1, you will have your T1, N0, M0. Alright. Paano naman pag nakita natin stage 2? Ano ng classification? Pag stage 2, makikita mo T2, okay, N1, M0. Alright. Paano kapag tinabi nating stage 3? T3 hanggang T4, lumalaki, N2, M0. How about pag tinawag na nating stage 4? T2 hanggang T4, N2 hanggang N3, okay, M1. Okay? Pag meron ka nang nakitang M1, may metastasis, stage 4, terminally ill na ang pasyente. Okay, so again, stage 1, T1, M0, T1, N0, M0. Stage 2, T2, N1, M0. Stage 3, T3, N2, M0. And stage 4, T2, N2, and M1. Alright. Now, what are the treatment modalities? Okay, so we have 5 major treatment modalities and nursing intervention later on. Okay, so first, you have your surgery. Second, radiation therapy. Third treatment is chemotherapy, hormonal manipulation, and last is your immunotherapy. Alright, let's start with your surgery. Tandaan, the primary modality of treatment for your cancer is surgery. What are the purpose? Surgery could be performed for diagnostic. What do you mean by diagnostic? Example, biopsy. No? So, pag sinabing diagnostic, yan ay tinatawag nating biopsy. Tinanggal natin ang tumor so that we need to detect or to confirm the presence of cancer. Okay, next one. You also have what we call your curative. Pag sinabi naman natin class na curative, it is used to eradicate the cancer or eradicate the tumor cells. So, tinanggal natin lahat. Or it could only be palliative. What do you mean by palliative? The surgery is only to relieve the clinical manifestations of the patient. Now, we have different types of surgery. What are those? Example, number 1, local excision. Anong tinawag pag local excision? That is the total removal of the entire tumor. Okay? So that is the entire tumor that should be removed. Total removal of the tumor. Wala kang ibang tatanggalin kundi tumor lamang. Okay. Paano naman pag pinag-usapan naman natin na wide, radical, or excision? Pag nakita mo na radical, example, okay, radical mastectomy. Ano nang ibig sabihin niya? That is the total removal of the tumor, lymph nodes that is involved, kasama din ang lymph nodes. Okay? What else? Aside from that, total removal of the tumor, lymph nodes, and the adjacent structures. What do you mean by adjacent? Ibig sabihin yung katabi. Okay. So, ibig sabihin, tinanggal natin ang tumor, tinanggal po natin ang lymph node, tinanggal din natin ang alin? Adjacent structure, yung katabi. Example, radical mastectomy. Diba? Pag radical mastectomy, tinatanggal natin yung, hindi lang yung tumor, yung breast tissue, the nipple and the areola. What else? The lymph nodes are also removed. Okay? Sometimes muscles are also removed. Yun yung tinatawag nating wide or radical. Nakuha ang pagkakaiba. Again, local excision, tinanggal lamang removal of the tumor. Wide or radical, we remove the tumor, the lymph node, and the adjacent structure. Alright, next one. Number 3, salvage therapy. Ano naman ang ibig sabihin ng salvage surgery? That is the surgical removal of the tumor plus with additional treatment. Surgical tumor with additional treatment. Ano yan? Say for example, chemotherapy before surgery. Ano ang goal? Bakit nagki-chemotherapy before surgery? So that to shrink the tumor cells for easy removal. Diba? O kaya naman, chemotherapy after the surgery. Why? That is to totally eradicate the cancer cells. So pag sinabing salvage, it is surgical removal of the tumor with additional or adjuvant treatment. Alright, next one. Electro, cryo, chemo, laser surgery. Isa-isayin natin. Pag electrosurgery, using cautery. Okay? Cautery ang ginagamit natin dyan. Pag cryosurgery, it is through freezing. Okay? Through freezing. Chemosurgery, through the use of chemicals. Okay? At pag sinabi nating laser surgery, that is through the use of light. Ito yung tinatawag nating laser or yung light or ilaw, di ba? So you have what we call your different types of your surgery. All right, let's continue. Another one, aside from surgery, radiation. All right, dito maraming questions with regards sa board exam. Ano po? So you have your radiation therapy. What are the purposes? Radiation could be a primary modality. Ibig sabihin, that is for the treatment of the cancer. Radiation could be an adjuvant. What do you mean by adjuvant? Pag sinabing adjuvant, together with. Okay? So, adjuvant therapy, pwedeng chemotherapy with radiation. Surgery with radiation. Or a palliative. What do you mean by palliative again? It is only to what? It is only to relieve the clinical manifestations or to relieve the signs and symptoms. Now, you have two major types of your radiation therapy. What are those two types? Okay, number 1. You have your external beam or unsealed source. External, ibig sabihin saan galing yung external? Sa labas, unsealed source. Number 2, internal or sealed source, nandun sa loob yung radiation. Tingin dito sa picture natin, okay, dito below, you have what we call, ito yung tinatawag nating external. Pag sinabi nating external, tinatawag din natin yung teletherapy. Wag kalimutan ha, ang ibang tawag sa external beam radiation is teletherapy. What else? Aside from that, yung internal naman natin, ito yan, yung mga through your wires, beads, diba? Okay, ito yung mga tinatawag po nating implants or radioactive implant. Tinatawag din natin itong brachytherapy. Maliwanag external, tinatawag na teletherapy. Example is your cobalt. Internal, sa loob nilalagay, tawag natin brachytherapy. Alright, so wag malilito dyan. Okay, next one. Okay. In radiation therapy, you have to take note about the potential toxicity that it may bring to the patient. Now, what are those toxicity? Number 1, alopecia. Tandaan, alopecia is the temporary hair loss. And you must remember that the temporary hair loss is usually reversible. Okay, so alopecia. What else? Erythema and desquamation. This is an example of an erythema. Ito yung area, no? Siguro ito ay thyroid cancer. No? Erythema, namumula, and desquamation. Okay, what else? Stomatitis and xerostomia. What is the difference between stomatitis and xerostomia? Stomatitis, this is an oral ulcer. Pag sinabi kong xerostomia, dryness of the mouth would occur. Okay, another toxicity, decreased taste and salivation. So, anong problem natin? Pag taste and salivation, so, eating patterns of the patient would be a problem. So, nagkakaroon sila ng loss of appetite or anorexia, as well as patient could have difficulty in swallowing. Esophageal irritation could also occur. And last but not the least is bone marrow suppression. Class, pag sinabi nating bone marrow suppression, it is also known as your pancytopenia. Anong ibig sabihin ng pancytopenia? Pan means all. Cyto means cell. Inya means decrease. So therefore, when we talk about pancytopenia, it is the decrease in all blood cell. Bumababa ang RBC, so the patient will be having anemia. Bumababa ang WBC, the patient will have immunosuppression. Bumababa ang platelet count, therefore the patient is at risk for bleeding. So they are what we call your bone marrow suppression or pancytopenia. Alright, so they are your toxicity. Now, when you are caring for a patient with or who undergoes your radiation therapy, please do not forget the principles. Okay, so what are those principles? Principle in protection, okay, in the protection of healthcare providers. You have your timing, distance, and shielding. Tandaan ha, kailangan we will not be exposing ourselves to radiation. Diba, diniscuss natin, the radiation that is used for the treatment of cancer is also the radiation that will cause us or will be as the carcinogen in the initiation and development of cancer. So therefore, as healthcare provider, we need to protect ourselves from the exposure from radiation. So these are the three basic protection or principles: timing, distance, and shielding. When we talk about the timing, the time spent to the client should only be minimum and it should only be for 30 minutes. Tandaan na, so timing natin, 30 minutes. Okay. How about the distance? Pag sinabi nating distance, the distance should only be within 6 feet. Ano? So, kapag yan ay beyond or kapag yan ay within that 6 feet, kailangan 6 feet and above na malayo tayo from radiation source. Diba? Kapag within 6 feet, anong possible na ma-damage? Within 6 feet, it could occur damage to what? To your cornea, damage to the thyroid gland may occur. So that is why it should only be 6 feet, or if it's converted into inches, that would be equivalent to 72 inches. Alright. And last but not the least is your shielding. Anong ginagamit naman nating shielding? Pag sinabi nating shielding, the shield that we are going to use is your lead apron. So as a healthcare provider, we have to use lead apron as a form of shield towards your radiation. So again, what are the principles in the care of a client undergoing radiation therapy? You have your timing, distance, and shielding. Timing, spent only 30 minutes. Distance should be 6 feet or 72 inches. Shielding, we need only to use your lead apron. Alright, next one. Okay, what are your nursing interventions when caring for a client undergoing external beam or your teletherapy? Now, skincare is very important. Do you remember one of the potential toxicity? The potential toxicity is your erythema and desquamation. So therefore, anong possible problem natin? The patient would be at risk for skin breakdown. What is the danger when there is skin breakdown? Di ba diniscuss natin, meron siyang myelo or bone marrow suppression. Pag may bone marrow suppression, bumababa ang WBC. So therefore, pag may break sa skin integrity, anong mangyayari sa pasyente? They would be at risk for the development of infection. So therefore, proper skin care should be provided such as the following. Number 1, use plain water. Bawal ang any harsh ingredient. Harsh soap should be avoided. Why? Those soap may contain what? May contain chemicals, and that chemicals may promote irritation of the skin, promoting skin breakdown. After washing the area with water, is you have to pat dry. Okay, pat dry. Pag sinabing pat dry, okay, you need to pat the area only. Do not perform the following. Do not rub. Say for example, ito yung area ng radiation. Bawal i-rub ang area. Why? Rubbing of the area may cause what? Skin breakdown. That would be the friction. Okay. Avoid scratching the area. Scratching again can lead to skin breakdown. And avoid poking the area of the radiation. So again, avoid rubbing, avoid scratching, and avoid poking. It can lead to skin breakdown. Okay, let's go back to our skincare. Next one. Tandaan, do not attempt to remove the markings. In a patient who are undergoing radiation therapy, meron silang markings. Yun yung palatandaan ng radiologist on the area that needs to be exposed to the radiation. So therefore, if we are going to remove the markings, the physician will not be able to determine the location or the area that needs to have the radiation therapy. So do not remove the markings. Tanda na, bawal tanggalin. Next one. Avoid direct exposure to heat and sunlight. O bakit bawal? Because avoid exposure to heat and sunlight, that is a UV rays. Tandaan, expose na siya sa radiation plus with UV rays, what will happen? It causes skin breakdown. So therefore, no heat, no sunlight, it may cause burn. Alright, next one. Wear loose clothing. Why? Restrictive clothing, again, may cause skin breakdown. And of course, do not apply anything. Bawal maglagay ng kahit ano, no? So, bawal maglagay such as ointments, lotions, powders, unless if it's only prescribed by the doctor. Right? Next one, nursing management. Okay, how about if the patient has brachytherapy or your sealed radioactive implant? Okay, don't forget, admit the patient to private room. Bakit kailangan ang pasyente ay nasa private room? Kasi kailangan sa private room kasi may bone marrow suppression. Anong problema? Immunosuppress. So therefore, kailangan nakalagay sa pasyente is a reverse isolation. Mabilis siyang mahawahan. Okay, next. Place notices on the patient's door. Why do you have to apply notices that the patient is highly radioactive? That is to protect other healthcare providers in the exposure of radiation. Next, wear dosimeter badges. Tandaan, dosimeter badges will not prevent the patient from or will not prevent healthcare providers from the exposure. But rather, the dosimeter badges will only what? Will only detect the level of what? The level of exposure. Hindi nito mape-prevent yung radiation, but rather, it will only detect the level of our exposure. Okay, next. Restrict the following visitors: pregnant and children. Why pregnancy? Kasi radiation is teratogenic. Pag sinabing teratogenic, it is harmful to the fetus. Okay. Children visitors, because usually they are immunosuppressed. So therefore, they are at risk in the developing leukemia. So tandaan, contraindication ng mga visitors, avoid pregnant and children visitors. Limit visitors. Why? Because the patient is on reverse isolation. So, ibig sabihin, mabilis mahawahan sila. So, you need to maintain your, okay, or to limit your numbers of visitors. Maintain distance. Naalala ba? How many feet? 6 feet or 72 inches. Provide gentle oral hygiene. Ano nga ang kanyang toxicity? It may cause stomatitis and xerostomia. Gentle to prevent your another ulceration. Oral hygiene, toothbrushing, and the use of your NSS as a form of your oral hygiene solution should be used. That is to prevent dryness or xerostomia. Another one, place on bed rest. Bakit kailangan naka-bed rest ang pasyente? Kasi pag brachytherapy, one of the possible problem is the dislodgement of the radioactive implant. Alright? So therefore, to prevent the dislodgement of the radioactive implant, then we institute bed rest to the patient. And if we are going to reposition the client, you need to place log rolling. Tandaan, bawal ang high Fowler's. Bawal ang frequent ambulation. Why? High Fowler's position, frequent ambulation will cause pull of gravity. Pull of gravity may cause what? May cause dislodgement of the radioactive implant. Alright, next one. How about the patient's diet? Paki-highlight. Tandaan po ito. What type of diet should be provided? The diet to be provided for the patient should be low residue. What do you mean by low residue? Low residue means low fiber. O, bakit bawal ang high fiber? Kasi pag high fiber ang diet, it promotes peristaltic movement. At kapag mabilis ang peristaltic movement, anong mangyayari? Again, dislodgement of the radioactive implant. So that is why low residue diet should be provided. Alright, next one. Avoid bladder distension. How do we prevent bladder distension? Bladder distension could be prevented by continuous catheterization. Bakit kailangan naka-catheter? Kasi bladder distension, once again, will cause dislocation or dislodgement. And of course, diarrhea. That is why we need to prevent diarrhea by providing or administering anti-diarrheals. Again, diarrhea will cause increase in peristalsis that may cause dislodgement of the radioactive implant. Alright. How about if the question asks you that the transplant or the radioactive implant is being dislodged? Okay, tandaan, if the radioactive implant has been dislodged, do not pick it up using your bare hands, neither, okay, using your gloved hand, okay? Neither gloved hand nor your bare hand should be used. Why? Because a healthcare provider can be exposed to the radiation. So therefore, if the radioactive implant is displaced, ano ang gagawin mo? Tandaan ito, this is a common board question. You need to use long-handled forceps and immediately place the radioactive implant on a lead container because lead is a type of shielding that will prevent the spread of radiation. Alright? So they are your important nursing management when we take care of a patient with radioactive implant or brachytherapy. Alright. To move forward, we are done with your radiation therapy. Natapos natin sa radiation therapy. Let's have now your chemotherapy. Alright. Now, your chemotherapy route is usually intravenous. Okay? But it depends upon the type of what? It depends upon the type of cancer. Tandaan, di ba yung primary mode natin, surgery. Ang radiation natin, when the tumor is localized. Chemotherapy is to prevent the metastasis. Pag sinabi nating prevent metastasis, usually, your chemotherapy has high affinity to your what? High affinity to rapid, okay, proliferating cells, okay? So, ibig sabihin, it destroys your rapid proliferating cells such as your cancer cells, okay? So, again, pagtandaan po natin, primary mode of treatment, surgery. Cancer is localized, radiation. When it is risk for metastasis, and to prevent metastasis, chemotherapy. Now, what is the usual route? The usual route for chemotherapy is your IV, intravenous. Ano po? And usually, they have cycle and a regular schedule for your chemotherapy. Now, what are those different chemotherapeutic agents? Okay, next slide, please. First, you have your anti-metabolites, antibiotics, alkylating agents, anti-meiotic agents, and topoisomerase inhibitors. Alright, what are the actions of these drugs? First, let's take into consideration your anti-metabolites. Pag sinabi natin anti-metabolites, it impairs cell division. It impairs cell division. Okay, so ano nga yung cell division? That is mitosis. So ang gagawin, hindi sila magdi-divide. Kaya nga sabi natin, it will impair the rapid proliferation of cells. So again, anti-metabolite impairs cellular division. How about the action of anti-metabolites and antibiotics? Okay, anong action? Pareho ang kanilang action ng antibiotics and alkylating agent. Okay, anong ginagawa nila? It interferes with RNA and DNA synthesis. Okay? So, anong tinatanggal natin dito para hindi magkaroon ng RNA and DNA synthesis? Okay. So, pag walang RNA and DNA synthesis, walang proliferation ng cells. So, that is the action of antibiotics and alkylating agent. Okay. How about antibiotic agent? Okay. Your antibiotic agent interferes with the formation of microtubules. Okay, interferes with the formation of your microtubules. microtubules. O, bakit? Kasi pag dumadami yung microtubules, siya yung nagiging source ng proliferation. So therefore, it is what we call interference of the formation of microtubules. And last but not the least, topoisomerase inhibitors, it prevents cell division. Okay? So once again, antimetabolites, again, it impairs cellular division. Antibiotic and alkylating agent, it interferes with RNA and DNA synthesis. Antibiotic, it prevents formation of microtubules. Topoisomerase inhibitors, it prevents cellular division. Alright, so they are your chemotherapeutic to prevent metastasis or if ang atin pong tinatawag na cancer is systemic. Ibig sabihin, kumalat na. Alright, now, what are the most common side effects in the use of chemotherapeutic drugs? So, side effect na po tayo. Okay, these are the most common side effect. Okay, so from head to toe, ito po yung mga pinaka-common, oral ulcer. No? So you have your oral ulcer. Okay? What else? The hair. Anong nangyayari? Temporary loss of hair. Anong tawag natin? Alopecia. Oh. Unahin natin yung alopecia. Tandaan, alopecia is what? Alopecia is only temporary and reversible. So therefore, you have to reassure the client that it will grow back. Okay? However, you need to tell them that the consistency, okay, yung thickness, the quality, and the color of the hair may change. That is why your most important nursing intervention is gentle shampooing of the hair. Tandaan ha, kasi madaling mag-break ang hair. So, gentle shampooing of the hair. Oh, what else? They will have your disturbed body image. So therefore, kung may disturbed body image, ano ang kailangan po natin gawin? You need to encourage the client to wear hats, wigs, 'di ba? Turbans, okay? So that they will wigs so that they will have an enhanced body image.